If you are having foot pain or discomfort, there is a high chance you are suffering from arthritis, but there are many non-invasive treatments to help preserve mobility and decrease pain. Here with some advice is Dr. Trevor Haynes with Elite Foot and Ankle Associates. Good morning.
Morning.
Okay, so what is arthritis of the foot and ankle and how common is it?
It's very common. Arthritis is basically just inflammation and breakdown of the joint, and it can be caused by a host of things, but it can be breakdown of the cartilage or just generalized inflammation of that joint.
And what are the symptoms that people should watch for?
So generally, beginning, it's kind of just pain with range of motion. As it gets worse, you also get some jamming, some clicking, some grinding in the joint, which can obviously be more painful.
Yeah, it does sound uncomfortable. What causes arthritis?
Yeah, so the most common cause is just generalized wear and tear and age, right? The joint breaks down over time. Otherwise, trauma can be a cause, as well as other systemic conditions such as rheumatoid arthritis, gout, things like that can also lead to arthritis.
And what about prior injuries?
Yeah, trauma is a big factor.
Okay.
Anytime you break a bone or anything like that and it involves the fracture kind of extends into the joint, you're almost inevitably going to end up with arthritis down the road.
Okay. What are the first steps in treating foot and ankle arthritis? What should people do?
Yeah, so first steps would be, get it looked at, figure out which joint is actually causing your problem, because sometimes that is even difficult for somebody to assess. And then second would be starting with just kind of anti-inflammatories, things like that. There's Voltaren gel, things over the counter that are like an anti-inflammatory cream. That would be your basic start, right? After that, you turn into more like injections, which we talk about, you hear more commonly cortisone injections. We try to steer away from those just because of the additional damage they can do to the joint. But you can do things like PRP, laser, red light therapy can also be very beneficial for those.
Okay, and what other options are available if those type of conservative treatments don't work?
Yeah, if conservative treatments don't work, you're kind of left with either bracing it so that it doesn't move as much to help with the pain, or depending on which joint it is, it might be surgery to fuse that joint so that it no longer moves.
Wow, okay. And how do you know when it's time to see a foot and ankle specialist? Maybe you have changed your footwear, you've tried those creams that you mentioned over the counter. When should they come in and see you?
Yeah, I think they should come in as soon as they're not seeing that relief and it starts to really limit their daily activities. When it starts changing how you do things, like if you're normally a runner and you're starting to go, well, I'm not gonna run today because my foot hurts, that's a problem, right?
Yeah.
Because that also can lead to other things. People who run, for anybody that's a runner, not running lead to depression and things like that. So getting out and moving around is ideal. So if it's really inhibiting your activities, you need to get it looked at.
Yeah. Okay, you brought a friend.
I did.
Tell us a little bit more about arthritis.
Yeah, so this is your foot, right? And you can see there's a lot of joints within this foot, right? Places we see it mostly are here in this great toe joint. We also tend to see a lot right through here in the midfoot. And then finally, we see a lot of ankle and kind of underneath the ankle, what we call your subtalar joint. Those are kind of the four areas we see it the most.
Okay, and how does insurance factor into all of this?
Yeah, so insurance will cover the visit, have it x-rays, maybe even an MRI if needed. They'll cover a cortisone injection if that's the route we want to go. They'll cover bracing a lot of times depending on the severity of the deformity or the issue that's going on. When you dive into the PRPs, the lasers, the red light therapies, those are going to be more out of pocket.
Yeah, PRP, that platelet-rich plasma, kind of the regenerative medicine aspect, may or may not be covered. You always say you treat everything below the knee. Correct. So name a few other things that you can help folks out with.
Yeah, obviously trauma. We also treat like wounds of the feet. And the legs, we treat tendonitis, fasciitis. We deal with neuropathy and nerve problems. So yeah, really anything below the knee.
That's right, exactly. And you have 6 locations. So tell people how they can make an appointment with you, find your locations.
Sure, they can reach out at 503-668-5210, or they can look us up on our website at elitefaor.com.
Yes, of course, find the location nearest you and the best treatment options for you. So thank you so much for coming. I always enjoy seeing you.
Thank you.